between other persons, and that is known as individual differences. So as you know, according to RS and Workplace DZ, individual differences are found in all psychological characteristics. That is, your physically some may differ from each other, by the intellectually or by the intelligent IQ or intelligent quotient, they are differ from each other. By habit, through the habit, they are different from each other. Through they may carry different personality trait and character traits. So there are two types of individual differences are there, what we discussed. One is physical and psychological. So one individual differ from other individual on the basis of physical characteristics and on the basis of psychological characteristics. So physical differences like your size of your body or height, weight, color of the skin, color of eyes, hair, size of hands, arms, feet, mouth, nose, waistline, structures. These are the physical things through which one person is different from another person. Psychologically, like your IQ, like your interest, attitude, habits, emotion, social and moral development. So through this also we are different from each other. So there are different types of psychological differences are there, but we discussed last class. Mental differences, differences in IQ level, then differences in attitude, emotion, motor activity, interest and aptitude, social and moral development. So what are the causes of this? We are finding the differences, we are finding the similarities between people. So what are the causes of these individual differences? One is heredity, another one is environment. So heredity is your nature, what the nature has given to you. Okay, people belong to different hereditary endowments and characteristics. We inherit almost all the things we need for the growth and development. We inherit from our previous generation, like color, like your height, weight, or any other characteristics or traits we are inherit from our previous generation for the growth and development we need. That is our what nature has given us. So it will not only contribute directly towards the differences in individuals in respect of their color of the skin, eyes and shapes, composition and working of various internal as well as external bodily organs, but also makes contribution indirectly by creating the differences in individuals in relation to sex. So in relation to sex, in relation to intelligence and other specific. If one's parent is very intellectual person, that their offsprings may be very intelligent. So that also can be inherited. If someone is very good at painting or art, then that can be also inherited to the next offsprings. So it's not like that only the physical characteristics will inherit to, or it will pass to the next generation. It's not like that. Intelligence, capability, attitude and some specific or special abilities that also can be inherited to the next generation. So what are the influences of heredity on individual differences that we will discuss today? What is the influence? Like intelligence. So heredity has influence upon the intelligence. Like if that on the basis of intelligence, one person is different from another person, and on the basis of physical condition, like physically one person is different from other person, like height, color of the body, shape of the body parts, or any other structure of the hand, structure of any body part. So through this also we are different from each other. So that is called a physical condition that also put an influence over the heredity on ID. Then aptitude and special talents. If someone is having aptitude or good at aptitude and special talents are there, that also can be inherited, and that can also create the individual differences. Okay, next is your temperament, emotional maturity and stability. That is also influence, put an influence upon the heredity. Like some may born with the good temperament or emotional maturity and stability, whereas other person may have the weak maturity, or they may have less maturity and social stability, and that is also creating the individual differences. some may easily getting very aggressive, but some person is getting very less aggression towards any situation. So that temperament, that can also be inherited, and that is making temperament is making the difference, individual differences. Then introversion, extroversion. Introversion, extroversion means introvert people and extrovert people. Introvert people is what? They are very shy in nature. They cannot share their emotions. They cannot share their feelings to others. Whereas extroversion people can share their emotions, share their feelings to others. So people those are introvert, means parents are introvert, their children may be introvert person, and those are introvert, sometimes some benefits are there, some means negative points are also there. Like introvert people, as they cannot express their emotions, as they cannot express their feelings, so that may create some negative impact on them. So they may drag towards the depression or some kind of psychiatric illnesses. Okay, like extroversion people or extroverted people, like they are very open up, they can share their feelings, they are very comfortable in a gathering, so whatever the emotion they can freely express. So these kind of people also can means they have less chance of getting certain mental illnesses. Through this also they are different from each other. Then dominance and submissive. Some people are dominant, some people are submissive. So dominant people are dominant others. They they put their own views, own suggestions over others. But whereas the submissive people, they obey others. They cannot put their own emotions. So those are dominant. They may have less sense of psychotic illness, whereas the people those are submissive, they may have greater risk of getting psychiatric illness. Then efforts making capacity. So every individual has some effort making capacity, but some may lose that effort making capacity at a certain point of time. Like if the person is overstretched due to any situation, due to any stressful situation, the person is overstretched, and he is unable to make the effort or to fight with that situation. But whereas other people can be stressed to any extent, he can adjust to any situation. So through this also, there are very less for the people who can adjust to any situation, they have less chance to get any kind of psychiatric illnesses, and they can adjust with any situation. Through this also, they are different from each other. Criminal tendencies, some may burn with the means not only burn, like some may if they are living in the criminal inducing environment, they may have the they may develop the criminal tendency. So through this also, they may different from each other. So these are the things which put an influence upon the heredity on, and that will create the individual differences. Next is your environment. Okay, so what is this environment? Environment which is around us. So the environment is everything that affects the individual except his genes. So the things which is beyond the genes, that is your environment. Okay, if it is genes, then it is heredity. If it is beyond the genes, that is your environment. So it covers all the outside factors that act on the individual since he begins his life. When we start our life, from that time we are exposed to ourselves, we expose ourselves to the environment. So environment is your nurture. Okay, heredity is your nature, but environment is your nurture. Okay, so the environment, the first environment for the fetus is mother's womb. Okay, so the fetus gets all the nourishment from the mother's womb. Through placenta, the fetus gets all the nourishment. The fetus gets all the emotion when the fetus is inside the womb. When the mother stressed, the fetus also stressed. When the mother happy, fetus also be happy. So that is his environment. So it starts from when our life starts, our environment starts with that is your mother's womb. So first environment for the baby is the fetus is the mother's womb. Next, after birth. So after birth, which one is your means environment? Your parents or your teacher, your family, your peer groups, your environment, community environment, like a temple, your school, your mass media, anything to which you exposes yourself. So after birth, these are your all environment. So you are exposing yourself to this environment. So this is called your influence of an heredity and causes of individual differences due to heredity and environment. So what are the causes of individual differences? That is your heredity and environment. So now we will go for individual when we are sick or during our health. So what is the individual differences? So individual differences in health and sickness. So it is very essential to recognize and accept the concept of individual differences among the patient. So we are coming across several types of patients. Okay, we are coming across different types. They are having different temperament. They are having different traits, personality traits, and we are coming contact with them. So it is very essential to recognize and accept the individual differences. We cannot say that all the patients will be very cooperative towards us. No, this is beyond their temperament. This may be beyond their personality trait. So we should be get ready that whoever comes to us, we will provide the best care to the patient. We will understand them best. Okay, so it is very essential to recognize and accept the individual differences. First of all, we will have to understand the individual differences, the concept of individual differences when a patient is coming to the hospital. No two patients are alike, what I told you. We cannot say that never. Two patients cannot be same like each other. So they are different from each other on the basis of physical characteristics, on the basis of psychological characteristics. They are different from each other intellectually. They are different from each other through emotionally or psychologically and socially. So we will have to accept their characteristics traits or personality trait. We will have to accept them whatever they are or whoever they are. As they are, we will have to accept them. So one principle of psychiatric nursing is accept the individual as he is. Okay, we have to accept the individuals as they are. So whatever their personality trait, whatever their intellectuality, whatever their sociable quality or their communicable quality, we will have to accept them anyway. So what are the causes of these individual differences? First one is heredity. Heredity, culture, educational level, then your socioeconomic status, age, occupation, coping factors, nature, and types of illness. So, as you know, from the beginning, we discussed about how the heredity is is causing the individual differences. So that is clear to everyone how the heredity is, whatever in our that will be inherited to the next upsprings. Then culture. So, in which environment you are born and brought up, that culture is very important for the individual differences. If suppose someone is living in a very nurturing, good nurturing environment, and one child is nurtured in a very criminal environment, a criminal insisting, stimulating environment. So they will adopt the things likewise. One is in a good environment, another one in a criminal tendency or criminal stimulated environment. So they will possess the characteristics as per their culture, as per their environment. Then educational, one is highly educated, another one is low educated. So they will be other things as per their, or they will have the individual differences as per their educational level. Those are having low socioeconomic status, and one person is having high socioeconomic. So as that will also create the individual differences. Next is age. So yeah, according to age also we behave. Like a small child, how the small child behaves, we cannot behave like that. So age difference is also there in individual differences. Occupation. So different people behave as per their occupation. You people are the belonging to nursing professionals or nursing fraternity. So your behavior is quite different than the engineering people. So through occupation also we are different from each other. Then coping factors, you can adjust with any situation, but some other people are, they cannot adjust with any situation. They are always what they are always in losing their hope, they don't have any confidence to handle the situation. They are having very low self-esteem, low self-confidence to handle the situation. Nature and type of illness, like if someone is having the means what, some kind of chronic illness, and one is healthy person, so through this also they are different from each other. Nature and type of illness, one is having general illness, another person is having chronic illness like cancer, so their behavior, attitude, everything will be different from each other. Those are having normal illness like fever, so after 4 days the fever will be subsided, but those are having cancer, HIV, AIDS, or any kind of chronic or serious illness is attached with them. So their behavior, their everything will be different. So both people are different from each other. Next, what is the impact of this variation, like age, heredity? What is the impact of this variation? So, or what is the impact of this individual differences? Some patients, what I told you, some patients are cooperative, some patients are very friendly and react in a cordial manner, while other remains aloof in some extreme cases. So I told you, you cannot expect that all the patient will be in a very well behaved person, or there will be very cooperative. No, we cannot accept like that, or we cannot our expectations should not be like that. Some patients are cooperative, some patients are friendly, whereas other patients are aloof. They may not share their emotion. They are introvert in personality and antagonistic. Antagonistic means what? What you will tell, they will argue with you. They will get aggressive. So opposite. Antagonistic means opposite behavior they will have, or resistant kind of behavior they will have. Some patients appear worried, some patients are stressed, are tensed, apprehensive, while others are very cheerful. They are cheerful in nature and appear to be reasonable and contented. So some people are content people, some people are very cheerful, and some people are with a small thing they will get easily worried. They will be very stressed and apprehensive. They will have the severe anxiety. So this kind of people are coming to you. So you have to handle them accordingly. Some patients understand quickly what you tell them, they will understand the things quickly and responds to the instruction readily, while others don't follow the instruction at all. Some may not follow your instruction because their educational background, their personality trait, their aptitude, their attitude are different from each other. Some patients are very selfish, they are very demanding, asking for getting the attention. But some patients are very sensitive to pain. Some people are very sensitive to pain, they cannot tolerate the pain. They are always, they will have the discomfort, they remain stressed, they remain apprehensive or anxious, and do not relax easily. They will be very restless, they will be very agitated. Hence, they don't cooperate well during their treatment. So, as they are very apprehensive, they are very sensitive to pain, they will not cooperate with you during the time of treatment. On the other hand, some remain calm and show little apprehension. They have the anxiety, but they will not show to you. They face the reality boldly. So, whatever the reality is that, they will try to face that one. Some patients express their problems dramatically, in an exaggerated way, in an excessive manner. They will express their, in a simple pain they will have, they will tell it in a very exaggerated manner, and are more or less childish, like they will behave like a child. In a small thing, the child will start to cry. So the people, those are very dramatical, they will cry, or they will behave like a childish and immature way. They crave for attention. They need attention, your attention. They need your sympathy from others. So like that's why they will behave like a childish way. Each of these patients requires special and individualized nursing care. So patient needs your individual nursing care. You cannot say that means at a time I will care in the same way, in the same technique, I will care all the patient. No, this is wrong. All patients, they as they are individual, as they are having the differences, so you will have to provide them in special and individualized care. whatever their need is there, accordingly you will have to understand them, you will have to identify their problem, and you will have to solve their problem. It is only sympathetic and understanding nurse who can make the necessary adjustment. So you have to adjust with their personality trait, you have to adjust with their individual differences which meet these individual differences. Then what are the nursing implication of these individual differences? As I told to you, because different types or different categories of people are coming to you. So your patients are coming to you. So you have to understand their emotion, you have to understand their feelings, and you have to provide care to them. So knowledge of individual differences, so you have to understand what is that individual. If being a nurse you don't have any idea regarding this individual differences, you cannot understand their reaction towards the stress or towards the illness. So knowledge of individual differences helps the nurse to understand various reactions of patients towards illness. In clinical practice, the nurse will observe the patients behaving differently. So you will have to observe different patients will behave in a different way. Nurse with the knowledge of individual differences can very well understand the reason for differences in their reactions towards illness. So you will have to understand the people is having these individual differences due to their illness, and this is the reaction of their illness. They are suffering, that's why they, suppose cancer patient, they will be easily very irritable, they will be easily very irritable and aggressive. Why? Because the pain is so much that they cannot tolerate, so their behavior is occurring. So this is the reaction towards the illness. They are having some illness, and this is the reaction towards that illness. So this knowledge helps the nurse to provide individualized care to the patient. So if you understand the individual differences very well, then you can provide the individual or one-to-one care to the patient. The knowledge of individual difference helps the nurse educator to recognize that all the students do not learn in a familiar way. So being a teacher, what is my personal experience I'm seeing in my class, if 100 students are there, means I cannot teach them in a same way. Okay, so we will have to understand their intellectual capability, in that their means mode of communication we will have to understand, so that we can communicate our things to them. Otherwise they will not listen to us. So it helps the being a nurse educator, you have to recognize that all the students do not learn in a familiar way. Some are fast learner, we have to tell them very few things and they can capture so many things. Some can concentrate for a longer hour, but some cannot, while other require more frequent rest period. So different attitude, different temperament, different personality of people you will get in your class, and you will have to understand them. You will have to do the adjustment with the students, or students mentality, or students mind. You, as per their mentality, as per their intellectual capability, as per their way of reading or way of adjusting to them, you will also have to adjust with them. So this is all about your individual differences.